Hi, welcome to my video entitled You Can Beat Your Thyroid Naturally. Now, you are watching this video because you're either a patient of mine, a friend of a patient of mine who got a DVD, or you're watching me on the internet, or you just happen to be searching around and you came across my video, and I'm excited that you're here. It, however, means that you're probably suffering with a thyroid problem, or a loved one is suffering with a thyroid problem, and you're looking for some more information on what you can do to try to recover naturally. More often than not, someone that's had a thyroid problem has had a thyroid problem for many, many years, and they're sick and tired and frustrated of having lab tests that show that they're normal, or having a doctor manage your thyroid by looking at your lab tests and trying to adjust your medications so that you're in the normal range. But you know that you feel really crappy most of the time and something else needs to be done. So that's what we're going to talk to you today with this video. We're going to introduce you to some metabolic testing that we do in our office, as well as functional nutrition and functional neurology that we use in our office to try to help manage your thyroid condition. Why am I talking to you today about thyroid conditions? Well, that's a great question. I had an acupuncturist who was a patient of mine, and he brought me in this book entitled, Why Do I Still Have Thyroid Symptoms When My Lab Tests Are Normal? And I read that book, and it was like an epiphany. A light bulb went off on all the patients that I had coming in with a number of not just musculoskeletal problems, but fatigue issues, concentration issues, depression issues, sleeping issues, chronic pain issues, brain fog, depression, feeling cold. And when I read this book, the light bulb went off to how I can help patients manage their conditions naturally. As well, some insights in this book told me about adrenal dysfunction, and because I have some adrenal problems myself with adrenal fatigue, they are all intricately related, and then I put together this presentation so that you can learn a little bit more about it. So if you are searching on the internet and you haven't read this book yet, it's entitled Why Do I Still Have My Thyroid Symptoms When My Lab Tests Are Normal? I would search for that book, read that book, and in fact, when you come in for a consult in my office, we give you one of these books. So this is a great book. It's how we practice in our office, and it's the reason why I'm talking to you today. So let's talk to you a little bit about who I am. My name is Dr. Joel Rosen. I am a chiropractic physician that practiced here in Boca Raton for the past 12 years. I am currently enrolled in Postgraduate Functional Medicine University. This is an awesome extracurricular study program where I become a certified functional medicine practitioner. Basically, we look at the body a little bit differently. It's from a biochemical, biophysiological point of view, meaning we have certain metabolic processes that happen in our body, and when we deviate from normal, then it's looking at what happened metabolically to try to fix that, and not just going on a medication or a drug or doing some kind of invasive procedure. It's basically trying to put on our forensic hats to figure out exactly where the breakdown occurred. I'm also studying blood functional chemistry through Datis Karazian. He was the author of that book that we just showed you. He put seminars on across the country. It's called Apex Energetics, and it talks about gut dysfunction, thyroid problems, blood sugar problems, gluten problems, neurotransmitter problems, and I put together this presentation today. It talks a little bit of all of that. As well, I studied under Michael Johnson. He wrote this book here. It's called What Do You Do When the Medications Don't Work? He has a group of doctors across the country. It's called the Neurometabolic Supergroup. If you Google lifechangingcare.com, you will see all the patients that has been helped by the doctors in our program that work with the different conditions that are chronic, and what we do metabolically and neurologically to help you. So that's an awesome resource for you too as well. Studied under the Apex Energetics. We talked about that. I also have an undergraduate degree in exercise physiology and also psychology. And I am currently enrolled in the American Functional Neurology Institute. We're going to talk a little bit of functional neurology today on this video. So as you can see, I don't fashion myself as the typical chiropractor. I am dedicated to continually learn, looking into the new innovative techniques to help patients with chronic conditions, not just back and neck pain, but a metabolic point of view, and that's what we're talking about today. So if you're watching this video, the first thing I really want you to get across is the fact that even though you may have a thyroid problem, it's not the only problem that you have. You have a bunch of problems, and I'm going to explain how that is. So the first thing you should get away is that it's not just a thyroid problem. In fact, if it was just a thyroid problem, then potentially the medication that you're on would help you. But you'll find as I speak, there's actually 6 main reasons why you could have a thyroid problem. And if you have one of the 6 main reasons, then the medication will help you. If you have 5 of the main reasons why you have a thyroid problem, the medication won't help you. But what I'm saying with this slide is that you don't just have a thyroid problem. You have a number of metabolic problems. Potentially you could have type 2 diabetes or blood sugar dysregulation. Insulin resistance, which basically means the sugar is unable to get into your cells. That could be because of high and low blood sugars. We'll talk to you a little bit about that. Obviously, you have a thyroid condition. That's what we're talking about. Potentially, you could have fibromyalgia, vertigo, sciatica, chronic fatigue, peripheral neuropathy, rheumatoid arthritis, IBS, insomnia, Crohn's, celiac, infertility, migraine headaches. So you're not just watching this video as a thyroid patient, you have what I call a physiological web of problems, and we have to address those one by one to see if we can have you recover from your thyroid condition. The metabolic imbalances are anemias, thyroid dysfunction, adrenal gland dysfunction, hormone imbalances, hidden infections, food sensitivities. So there's a lot of things that were going on. This is a great slide because it basically tells you exactly what we're going to be talking about. All cases that come into the office are typically a combination of a neurological condition and a metabolic condition. And those are the different therapies that we're going to do to help you recover from that. So let's talk about metabolism. You know, we're a metabolic program. Metabolically, what is metabolism? The easiest way to describe what metabolism is that you eat food and it gets converted to energy. That's simple enough. That's the best way to, your cells have a certain activity or a function, a life function, and they're active and they need energy to be active, and that's what metabolism is. One of the questions I wanted to put together is, if you're watching this video, 30% of our energy goes to what system? So when we have, we eat food, it's converted to energy. Where does that energy go? Does it go to our endocrine system? Does it go to our digestive system? Does it go to our nervous system, our immune system, our cardiovascular system? The answer is it goes to our nervous system. So that our nervous system is our brain and our spinal cord. And so we need proper functioning thyroid for proper energy. So if we have a metabolism and that food gets converted to energy, in order for that food to get converted to energy, you have to have your thyroid working properly. That's why you'll have people who have thyroid problems that have no energy. So I wanted to talk to you about the connection between the thyroid and the brain and what we can do to try to help you with that. So what are some of the thyroid symptoms? Thyroid symptoms are fatigue. We just mentioned that. That's because we're not utilizing energy optimally. Increased weight gain when you're not even trying to, or in fact you may be trying to lose weight. So your metabolism slows down. How fast you burn calories slows down. Morning headaches that wear off as the day goes on. Depression, we'll get into why that could be with the depression. Constipation. So basically our body systems have slowed down, and metabolism is necessary for elimination. And if you have a metabolism problem or a thyroid problem, then you're getting constipated. Oversensitive to cold weather, so you're always cold. Your thyroid regulates your body temperature, which is based on your metabolism. It's like a fire. The more fuel that's in there, like the more logs that are in the fire, the more it's burning at a higher rate, the warmer that flame is. Whereas if your metabolism is slow, there's not a lot of fuel in the fire and it's burning really low. So you'll be very cold. Poor circulation and numbness and tingling into the hands and feet. Muscle cramps while at rest. You get colds very easily. Your immune system is depleted. And again, we're going to talk about that. Your wounds heal slowly. So again, that has to do with our metabolism and how fast our cells turn over. And it's not necessarily wounds. It could be back injuries, neck pain. And that's why we got into this. I had patients that were coming in that had back pain, neck pain, sciatica, and they weren't healing quickly compared to some other patients. And it wasn't just all about a musculoskeletal problem. They require excessive amount of sleep. This is probably one of the biggest ones that you are familiar with. So you sleep and you sleep and you sleep and you still don't function properly. Probably something going on with your adrenal gland, and we'll talk to you a little bit about that today. Chronic digestive problems, hypochlorhydria, that's a huge problem. Many patients have inability to secrete enough stomach acid over time, and by the time you're 30, it's said that you've depleted your hydrochloric acid reserves. You're no longer disinfecting food, and then that creates a whole host of inflammation in your body. And when that happens, then sort of all goes to hell in a handbasket, if you will. Itchy skin, dry and brittle hair. The hair falls out easily. There's swelling. There's loss of the outside portion of the. So these are the main symptoms. So if you have 1, 2 of these, potentially you have a thyroid problem. Or there's also sometimes symptoms of hyperthyroid. That would be heart racing, anxiety, palpitations, not being able to sleep. More often than not, you could have what's called an autoimmunity, Hashimoto's, and we'll talk about that, where you're going to have some of the symptoms we just mentioned with the thyroid being slow and low, and also some of the symptoms where it's elevated as well. So you'll elicit a little bit of both of those. All right, so thyroid support. What else does the thyroid do? The thyroid, basically, the way I have been told, a good analogy, it's like the janitor of the school. So he goes in, he turns on the power plant, he turns on the power supply. He warms up the heat of the furnace. He gets everything ready for the school to function. That's sort of like the thyroid in a crude way. It's responsible for your bone metabolism. So if you have potentially diminished bone density, that could be a thyroid issue for mineral content. We just mentioned immune function. So if you get colds a lot quicker, then your thyroid helps regulate your immune system. That's a reason why you could have that. Brain and nervous system, your endocrine system, so our hormones, not just thyroid, but our sex hormones, our adrenal hormones, we can have a problem with that. Gastrointestinal problems, liver and gallbladder problems, growth hormone problems, burning fat, so our metabolism again, insulin and glucose metabolism, healthy cholesterol, and proper stomach. So basically your thyroid there's a thyroid receptor in almost every cell of your body, and if your thyroid isn't functioning optimally, then those cells of the bodies that have thyroid receptors, almost like a messenger to speed up or slow down, it's not going to be functioning optimally. Okay, so the crosstalk. So what I try to tell patients is the thyroid talks to the immune system, and the immune system talks to the thyroid. The thyroid talks to the gut, and the gut talks to the thyroid. The thyroid talks to the brain, and the brain talks to the thyroid. The thyroid talks to your endocrine system, and the endocrine system talks to your thyroid. One affects each other. So let's talk a little bit more about that. This is a really hard diagram. I don't want you to get too overwhelmed by looking at it, but basically, if we look at the process here, your brain, your hypothalamus is sort of like the air traffic controller. So it's taking inventory of what's going on in your body, and it tells the rest of your body when to speed up or slow down or what to do. So basically, if let's say you're cold, it's cold in your house and you need to increase your body temperature. The hypothalamus gets the message and sends TRH, thyroid releasing hormone, to the pituitary. The pituitary now is the one that is sort of like the sergeant and tells the troops to go mobilize, and it will tell the thyroid gland to produce TSH. And then the thyroid gland is going to produce TSH through something called TPO. That's an enzyme that helps manufacture thyroid hormone. When that happens, T4 is of all the thyroid hormones that the thyroid produces, it actually should be the other way around. 93% is the T4 and 7% is the T3. And the T3 is the active form. Now, these hormones now take a taxi cab to different cells in the body. T4 needs to be converted to T3 because T3 is the active form. Now, so if you have a liver problem and your liver is not functioning optimally, 60% of that conversion of T4, the inactive, to the T3 active form takes place in the liver. The best way to think about T4 is if you have a coffee grinder and you're gonna brew up some coffee, you wouldn't put the beans directly in the filter and try to expect you have a nice cup of coffee. That's what T4 is. So, but T3 is the ground up coffee. So T4 has to turn into, we got to get a coffee grinder, if you will, and 60% of the body's coffee grinder of T4 into T3 is the liver. So if you could potentially have a thyroid test that your TSH says that it's normal, but you may have liver dysfunction and you have a conversion problem, and that needs to be looked at, which in amazement is not being looked at. Another 20% occurs in the gut. So we're going to talk about the role of the importance of a healthy gut or healthy gastrointestinal system. If you don't have a healthy gastrointestinal system, 20% of the conversion of T4s into T3 is in the gut, and that could be a problem as well. And then 20% is in other tissues. So that talks about that. I don't want to get into this just yet. We'll talk about that in a little bit. So we just talked about that, the thyroid basics. The hypothalamus sends signals to the pituitary via the TRH, the thyroid releasing hormone. The pituitary gland sends signals down to the thyroid to release TSH. And that's what you're mostly seeing on your blood test. So you may be seeing TSH, but you may not, and your TSH may be high or maybe low, and your doctor is giving you medication to sort of manipulate that, but he is not or she is not looking at all the other pathways that could be occurring where there's breakdown. TSH causes TPO, that's the enzyme that stimulates the release of T4, and again, that's a mistake. It should be 93%, and T3 should say 7%, and then they take a taxicab thyroid binding globulin. So now, one of the things that is essential that you need to do, if you didn't watch any more of this video and you said, okay, I understand that I may be having a thyroid problem, I want to go see my doctor and I want him or her to order me tests, the best test I would tell you to do is do thyroid antibody testing. And it's an antibody to TPO and an antibody to TBG. So what that basically means is your body has created a defense against your own cells, and it attacks TPO. And your TPO is unable to produce TSH. Or it takes an antibody against TBG, and you're unable to have a taxicab to take your thyroid hormone across the body. If you took medication for TSH, it wouldn't matter that you had a TPO antibody or TPG antibody. It's not going to help it. Hopefully that makes a little bit of sense to you. All right, so we also talked about 60% of the conversion of T4 to T3 is in the liver. If you have a poor functioning liver, then you have a poor conversion of T4 to T3. Enzymes, we look at AST, ALT, so bilirubin. Those are certain things that you can look for liver function. We also do muscle testing in our office to test if your liver is functioning optimally. But we look at it from a functional point of view, which I'm going to get into in a couple seconds. 20% is sent to the gut to be converted, and then 20% of T4 is converted in the peripheral cells. So what I want to talk to you now is about lab tests, normal lab tests versus functional lab tests. You may be told that your lab tests are normal, but you may actually still feel crappy. And so what I want to tell you is that those lab tests are inaccurate. They're not necessarily a way to tell you you're healthy. You're just basically compared to whoever took a lab test that year, basically an average of all the sick people that went for lab tests. And if you are beyond the high of the high and the low of the low, you're given medication. But it doesn't necessarily mean you're healthy. And again, the way I explain this is, let's say you had a kid who was in school and they were getting a C on a test. And so that's what a functional range is. So a C, it's a more accurate reflection of how you're doing today, what you're trending. You wouldn't wait till the end of the year and then wait till that kid failed the test or failed the course to start giving them some kind of extra help. When they get an F, that's what a laboratory range is. So when you're beyond the high and the low, they give you medication to correct it. Whereas if you're getting a C, then what's happening is you should get extra help at that point. That's a functional range, and let's talk a little bit about that. So the laboratory tests are high on the end, and then the functional ranges are normal. So you can still feel sick, but your doctor will tell you you're normal. It doesn't necessarily mean you're healthy. It just means that you're not too high or too low to start taking some kind of medication just yet. So let's give you a couple of examples. Glucose. On a traditional test, it's 65 to 110. These are always changing. Some tests say 65 to 99. But from a functional range, it should be 85 to 100. So what that means is if you, let's say you're in the middle here. So let's say you are 65 and 85. Let's say you're 75. 75, you're told that you don't have a problem, but from a functional point of view, you're not healthy. You have what's called reactive hypoglycemia, which means that you get irritable, shaky, lightheaded. You have too high of a roller coaster up and down. I'm sure your loved ones would tell you if you're hypoglycemic, you need to eat. What will happen in these cases is that you become insulin resistant, meaning you're always causing your hormones to try to get sugar into the bloodstream, and ultimately your cells stop listening to those hormones, and that will affect your metabolism, because your metabolism is how we convert food into energy. And so it's very important, the bottom line is to look within the functional ranges. And one of the things we do when we do a consultation with someone is we send you probably 30 pages of paperwork to do a health history, a dietary history, a family history, an environmental history. And then we ask you to fax over any recent blood tests that you have so that I have all that completed before we sit down and I do an evaluation. I'll put it on a functional range and I'll tell you where you may have problems, where you may never have been told you have problems. TSH, I'd say, is probably the most important, anywhere between 0.3 to 5.7. That's a huge range. Look at what's normal, 1.8 to 3.0. So let's take another example. Let's say this person was 3.3, 3.4. They're really in the middle of that range, but they are told that they are normal. What I put here is 4.2 and beyond is considered hypothyroid. So you can see 4.2 to 5.7. You may be told you're 4.7, and from that functional range, it's a hypothyroid problem, but you're told you're normal. And you're not told there's anything wrong until it's 5.7. By that point, so much changes biomechanically or biochemically and physiologically have occurred in your body that you do need medication. Why wouldn't you do something holistically and nutritionally to try to address those dysfunctions? Other examples are cholesterol, triglycerides. So basically, the lesson of this slide is your lab tests may seem normal, but they're not necessarily healthy. And it's very important that we look at your lab tests to be able to determine where you're trending and how we can address those naturally. The other thing is lab tests for thyroid is very, very incomplete. A lot of the times I'll do a review of someone's lab tests and we find that they've only done TSH and they've been on medication for 8 years only based on TSH alone. However, we have a whole bunch of other tests that you can do, and it's more encouraging. I'm seeing better, more complete tests, but basically we have total T4, we have the free thyroid index, that means the amount of T4 that's available. We have the free T4, we have the T3 uptake, we have the free T3, we have the reverse T3, and what I'm not seeing again is these thyroid antibodies, TPO, TBG, and also TSH itself, which is basically Graves' disease. So you need to get those tested, and those are things that we can do in our office if you're interested. Typical thyroid tests basically that I see are TSH and T4. And the question I have is, how can you manage your health without having all the information? You're burning out the thyroid gland with hormone replacement when meanwhile it could be a converting problem, or it could be an antibody problem against a particular enzyme that makes thyroid. And every time you take thyroid, you're creating more attacking of that thyroid. And that's why you feel lousy when your lab tests are normal. So in order to manage your health, we need to have all the causes of your problem, not just one problem. It's not just one problem. Hashimoto's thyroiditis, we talked about this a little bit earlier. These are not a thyroid problem, it's an immune problem. There's something going on with your immune system causing you to create antibodies that are hypervigilant and attacking different things in our body. There's an imbalance in your immune system. So that's what I wanted to talk to you today. There's proper testing you can do. So how would we have a problem with our immune system? There's a breach of our immune system. The example I use is a house. So if you have a house and it's a fully functioning house, the doors work, the locks work, the windows work, there's no cracks, then you are having non-penetration from the outside into the inside. But when you have a screen door that's ripped, you have cracks in the roof and water drips in, then you're having a breach of that barrier system. We have barrier systems that have a breach that protect us from the outside. And when that barrier system gets breached, then it creates an immune reaction. So that's what happens. So with you thyroid patients that have an immune problem, you've had some kind of breakdown of your immune system through the barrier system. And the natural barrier systems are our skin. So if you see people with a lot of rashes, then they're probably in cuts, psoriasis, they're getting a breakdown of their barrier system of their skin. We also have our lungs is a barrier system. Our eyes is a barrier system. And our mucous membrane is a barrier system. The most important barrier system of our body is our gastrointestinal system. So 80% of our immune system is in the gut. And if you have a breakdown of your gut or you're getting leakiness of your gut that's not protecting the inside from the outside, then there's a breakdown. And that's a problem. So we need to look to your gut. Th1 and Th2, there's a phenomena of Th1 and Th2. Th1 are basically our cell-mediated natural response. So these are things like digestive enzymes, acid. These are our natural ways that we kill any foreign invader. Also, we have a Th2, which is our humoral immune response. This is when we create antibodies. So our white blood cells come in, they tag the particular foreign invader. So anytime that foreign invader comes in, that antibody is created. So that's Th1 and Th2. Those should be in balance when we're functioning optimally. And if you've had a barrier system breach, and you have an imbalance of the Th1 and Th2, then that creates a bunch of problems in our body. That's basically what I'm trying to tell you with this. We also have a Th3 system, and this is a balance between the Th1 and Th2. In most autoimmune patients, we find that Th3 is failing, and then Th1 and Th2 become out of balance. So it's very important to know which sort of way are you balancing. Autoimmune disease. So again, you can see the Th1 is dominating here, the Th2 is dominating here, and then that creates a chronic illness. Also, cytokines, there are chemical messengers. They tell our body how to function properly when there's an immune problem. When the cytokines are going crazy, basically, then they start attacking different tissues. Now, why would they do that? Why would the immune system go out of balance, which we talked about a little bit earlier? Blood sugar problems, chronic inflammation, bad adrenal glands, your hormones are imbalanced, there's neurological imbalance, pregnancy. A lot of patients come in that have had a recent baby, and they said before the baby they were great, and then after the baby they weren't great. They felt lousy, cold, brain fog, couldn't sleep, couldn't lose weight. What happens is that shifts our immune system from one dominance to another dominance, and then we start getting an attack of our own immune system. Low vitamin D, chronic infection. So there's all these things that are going on with your body, and you need to do proper testing. A TSH test is not going to be good in and of itself. So you need to do the proper testing. The other things that you need to do is once you do the proper testing, you need to remove whatever's stimulating the body. A lot of the times I'll get a patient who has, say, an Epstein-Barr virus or a herpes virus, and we do these tests and they take TSH all the time, but they're not fighting, their immune system is attacking their own body because the viral infection is creating that immune compromise. Other things we do in our office to help alleviate the symptoms of thyroid is emulsified vitamin D, glutathione, which is the best natural antioxidant in our body, nitric balance. That's the active component in that is nitric oxide, which is a vasodilator and an immune suppressor. We use those supplements in our office. Fish oils, but the most important thing is to remove the offending invader. We also use herbal compounds by Apex Energetics. So let's talk about the 6 major problems. So I talked about earlier, if you had a thyroid problem and you go on TSH or a levothyroid or Synthroid or Armour thyroid, one of the 6 problems is going to be helped, but the other 5 are not going to be helped. Let's talk about all these problems. The first one is primary hypothyroid. Basically with this, the thyroid gland gets lazy and the pituitary gland tries to kick it in the rear to get it active. So the thyroid's not functioning well. The pituitary, being the air traffic controller, sees that it's low. It tries to wake it up, and then you go on TSH. And that's when you'll be helped. So if you have a primary problem, your thyroid's not functioning optimally, then what will happen is when you take TSH, you're going to be helped. But that's not the main reason why people have thyroid problems. It's the only one that's going to be helped with a thyroid. Hashimoto's is not going to be helped. Nutritional support, if we catch this early, is thyroid gland, what we call glandulars, ashwagandha, vitamin A and vitamin D. We can also do things to help support T4 to convert to T3. We also use different compounds for that. Type 2 is a hypothyroid secondary to pituitary hypofunction. So the pituitary, the air traffic controller, isn't able to tell the thyroid to speed itself up. So now in this case, the pituitary gets lazy, not the thyroid. One thing that may happen for this is we're chronically stressed. If I have a lot of stressors in my body, or I have an infection in my body, or I have blood sugar dysregulation in my body, I'm overstimulating my pituitary to do its job. It becomes desensitized to everything that's going on, and thyroid stimulating hormone particularly is not going to help that. What else? Creams and estrogens could be a reason why that would happen. Postpartum depression, pregnancy helps fatigue the pituitary. We just talked about sugar problems. Again, we have a list of different nutritional supports that we use for that, and they work very well. Underconverting. So basically we have the T4 and the T3, and 93% of T4 is produced when TSH is made, and then 7% is T3. And then 60% of the conversion goes in the liver, 20% in the gut, 20% in the peripheral tissues. The liver, the gut, the peripheral tissues aren't converting into T3 enough. That's a problem. Taking TSH to the cows come home is not going to help this. Why would we have this problem? Chronic adrenal stress is a problem. Again, chronic inflammation, gastrointestinal problems. This is often missed because T3 won't necessarily be tested. Again, we have some nutritional supports we use for that. Now we have an overconversion. That means that too much of T4 is converting into T3, and what happens in this case is there's too many taxi cabs that are driving, that are taking T3, and there's not enough free fraction of that hormone. Things that cause this is insulin resistance. You have too high blood sugar levels, and then there's too much binding of T3. We also have too many taxi cabs. That's too many TBGs. Something that can cause this is oral contraceptive. That's another problem. And again, we have nutritional support to help that. Thyroid resistance. Pituitary and thyroid glands are fine, and so are the hormone levels. However, the thyroid, the cells are no longer listening to the hormones. Again, chronic stress. So you see a lot of the times it's chronic stress. And one of the things we do in our office to measure your chronic stress is adrenal testing. All right, so what are some of the testing that I just mentioned, adrenal testing? What are some of the testing that we'd like to do in our office if you come in? We'd like to do a metabolic test of all your analytes. So the T4, T3, reverse T4, reverse T3, T3 uptake, thyroid antibodies, vitamin D levels, oxygen levels, red blood cell levels, kidney function. We need to look at all of that from a functional range. You may have all those done already, but it may have been a while, or you may not have any of those done. We need to be able to evaluate that. Adrenal stress index, this is a hormone test that we measure your adrenal glands from a circadian rhythm point of view. We have 4 readings. We measure it in the morning, we measure it in the afternoon, we measure it in the mid-evening, and then the evening. And we want to take a look at how your adrenal, remember we told you there's a converting issue if your stress levels are too high. So we need to look at that. Stool microbial ecology. You could have a parasite, you could have H. pylori, you could have bacteria overgrowth, and all of that is stimulating an immune reaction, creating Th1 and Th2 out of balance. When that happens, you start attacking your thyroid. If you take TSH, you're not going to fix that. You have to fix whatever's going on in your gut. So we need to be able to test for that. Other things that can happen is we can have a yeast infection, candida. So we need to be able to look at that. This is probably the best thing we do in our office is we look at the leakiness in your gut. So we talked about having a barrier system problem where you're having leakiness in your gut. We need to be able to look at your gut and see if there's any breach of those tight junctions. That's what we call array number 3, leaky gut. We also want to see if once that leaky gut is there, do you have any antibodies to gluten? Now I know what you're thinking. You may think, I've already done a gluten test and the doctor told me it was normal. Good. That means that probably the 2 antibodies that they tested you for, typically it's transglutaminase and it's probably gliadin antibodies IgA. But I want to let you know there's probably, I think it's 23 or 24 other antibody structures, or sorry, other peptide structures. So in English, what that means, it's an incomplete test. They tested you for 2 of the 24 peptide structures that you could be reacting to that you were told you're negative because they only tested 2 of the 4. So there's nothing as complete as these antibody tests for gluten in my office, and most of the time, people that have Hashimoto's problems have gluten tests. So if you're watching this and you've been told that you have no sensitivity to gluten, although you have a thyroid problem, I'd probably say the test was incomplete. Or another thing is the test may have been complete, but your immune system is so fatigued and so tired that it no longer spits out antibodies to gluten because it can't. So a lot of false negatives with those testing. We also do cross-reactive testing. So you may be told, yep, you're gluten sensitive, don't take gluten anymore, but meanwhile you're sensitive to milk, eggs, soy, and other gluten-like problems like quinoa, rye, barley, spelt, a lot of different non-gluten but equally reactive peptides that you're reacting against. So we need to test you for that. One of the tests that they do nowadays is a antibody test to other organs. So we do that in our office too. So you may have a gluten sensitivity, and that gluten sensitivity has created an antibody against your thyroid. But now you've also have an antibody against your, let's say, your intrinsic factor, and that's pernicious anemia. Or you could have an antibody against your cerebellum or your adrenal gland. So we need to test, are you only coming in with a thyroid antibody, or are you coming in with antibodies against other systems as well? So you may think you're actually thyroid problems, but now you actually have other Crohn's problems, IBS problems, diabetes problems. So we need to test you for that as well. Again, the triad of Hashimoto's is antibodies to TPO and TBG. You're gluten sensitive, and then antibodies to other cells and other tissues in the body. In this case, lowered B12. You're going to the store, you're taking B12 shots, but meanwhile you have an autoimmunity against your intrinsic factor, and you're unable to absorb B12. So we need to fix that. You could have antibodies to your pancreas, to your myelin. So these are the tests that we're doing in the office. You could have antibodies against your cerebellum, and that would cause brain problems and balance issues. So this is the leaky gut. We talked about this earlier. When we have a breach of these tight junctions, the food that we eat comes in here, it comes into the bloodstream, and then we start attacking that with antibodies, and that creates inflammation in the body. By now, hopefully you've answered the question, what makes our office different? We look at people metabolically and neurologically. Basically, I like to tell patients we don't leave any stone unturned. We need to figure out exactly why you're having an immune reaction against your thyroid, if you are, which chances are you are, and how we can fix those problems. So functional medicine, again, we look at your lab tests from a broad, more narrowed point of view. We look at your gut, we look at your thyroid, we look at your adrenals, we look at your liver, we look at see if there's any anemia concerns, sugar regulation, autoimmunities. But let's talk a little bit about neurology. So 80% of our immune system is in our gut, but we also have another area we need to focus on, and that's the brain. So the brain is responsible for every function in the body. It's responsible for cognitive function, for sensing things, for pain, for working our organs, our tissues. Is responsible for everything. And if you have a metabolic problem, so let's say you have inflammation, you have a blood sugar problem, you have infections, you have an oxygen problem, then you're not getting the proper fuel to your brain, then you're having other problems. You're having balance problems, depression problems, sleeping problems, a whole host of other problems that are regulated from your brain. All right, so the brain connection is your brain is one big sensory organ, your body is one big receptor. So whatever is going on in your body, it's relating information to your brain. Your brain stays aligned from constant input from its receptors, and also glucose and oxygen allows the nervous system to function optimally. We have receptors in our muscles, in our joints, in our skin, in our eyes, our ears, our nose. If there's a afferentation or there's a lack of nutrition to the nervous system, then it's going to cause deficits in our brain. We could have things such as blurred vision, increased sweating, difficulty falling asleep, dizziness, heart palpitation, cold hands and cold feet, sensitivity to light and sound. So these are a lot of overlapping symptoms with your thyroid. It may not only be your thyroid, but it's the fact that your fuel and activation to your brain is being diminished because of your thyroid, and they further aggravate or cause these problems here as well. How does this happen? Chemical stress, physical stress, emotional stress causes the brain to not fire optimally. Anemias and blood sugars, we talked a little bit about that. Food sensitivities, having a sensitivity to gluten, we need to test for that. Immune system being out of balance, poor diet, hypothyroid problems, drugs and medication. You could be taking antibiotics for any type of infections you may have. That wipes out the healthy bacteria. 20% of T4 is converted to T3 in the gut. You've just knocked out that pathway. Adrenal gland disorders, we talked a little bit about that. So what can you do about all this? What are you going to do to help me if I come into your office? Well, we need to address your fuel. We first need to figure out why, but then we need to fix the fuel source of oxygen and glucose, and then we need to activate the brain if there's a brain deficit. The neurological breakdowns is there's cerebellum problems. We've got to fix the cortisol levels, normalize the blood sugar, balance the hormones, get more oxygen to the cells, and coordinate the brain. So what's next? Now that we've watched this entire video, I'm going to offer you my visit offer. Basically on visit 1, we're going to do a complete neurological examination. This is to determine if there's been any offset of firing on your nervous system. We also want to know, we want to look at all your existing lab tests. So you're going to fax that in to me. I'm also going to get you to fill out probably 30 pages of paperwork. If those 30 pages of paperwork aren't finished and you don't send in your blood tests, then I'm not going to see you. You're going to come in. I'm going to give you a copy of Dr. Karazian's book so you can read that. Visit 2, we're going to go over if I can accept your case or not. I go over the testing results that we did, the neurological examination results, and then I'm going to put together a treatment plan for you. However, I'm not going to do this if you're not with your significant other. That's because it's my office policy that your spouse or your significant other needs to understand the severity of your problem and needs to be supportive. I only accept 5 new cases a month. It takes me a lot of time and energy to be able to look through your testing results, look through all your paperwork, and give you all my time and energy. Typically, this would cost $450 for these 2 visits. However, if you sign up after watching this video, I'm going to make you sign an affidavit saying that you did watch this video. It's only going to be $60. So I want you to call my office right now, 561-883-0090, and set up an appointment. A couple things I want you to know is there's 3 rules for you to be accepted in my office. Is number 1, you must be willing to make serious life changes. It's not going to be a magic pill. Take a pill, go to bed, wake up, and everything's great. You need to be able to take changes in your life. If you're smoking, you need to stop smoking. These are serious changes. If you're not ready for this, then please don't sign up. You have to take accountability for your health. What that basically means, it's you alone that has to do this. It's sort of like number 1, but it's more important. A lot of people will say, well, does my insurance cover it? That's you not taking accountability, because if your insurance doesn't cover and you're not willing to do it, then you haven't taken accountability for your health. You're telling insurance that they're accountable for your health, and insurance is not accountable for your health. Insurance wasn't accountable for buying your house and you bought your house. Insurance wasn't accountable for buying your car and you bought your car. You thought it was important. Insurance is really a broken model. I wish they were accountable for keeping you healthy. They're just accountable for any really traumatic or really, I would guess, really, I guess like an insurance policy. It's if in case you get sick, it's going to help you, but it doesn't keep you healthy. And then as well, people ask me, does my insurance cover this? Insurance and Medicare may pay a small portion of this, but we find that we make our plans affordable, that 96% of the people that we offer this to can make some kind of arrangement to afford to be able to do this. If people are asking me how much does it cost, I don't know. Every patient is different depending on what I find and what tests we need to do and what treatment we need to do. But I've put on average anywhere between $150 to $300 a month. So if you're not willing to invest that amount of money in your health, I'm glad you watched this video. Hopefully we've given you awesome information. Go and watch that or read that book, the Thyroid book. Go on Life Changing Care. There's a lot of change your diet. There's a lot of things you can do, but that's not going to work in our office if you can't afford that. One last thing I want you to ask yourself is, on a scale of 1 to 10, how serious do you think your problem is? Are you able to function? Do you feel like your old self? Are you happy? Are you enjoying life? Are you enjoying your grandchildren or your children? Are you able to spend time with your parents? Do you travel? Are you having any quality of life? 10 would be zero quality. Or let's say 10 would be an awesome quality of life and 0 would be death. So no one's hopefully watching this video with 0. Where would you be? How has this affected your relationships at work, your relationships at home? Are you able to work? Are you able to be productive? How serious are you about eliminating your problem? If you've watched this video to this point, you probably are very, very serious and you need to come in and take action. I want to thank you for watching this video. Again, my name is Dr. Joel Rosen. If you have any questions, please call David. He's going to leave a little information on how to contact us, and I look forward to helping you with your thyroid recovery. Dr. Joel Rosen, and I hope you enjoyed my video.